All right. Well, good morning, everyone. We are so excited that you're here, and we're so appreciative of all of your participation over the last 4 or 5 capital chats we've had throughout the year. And we're really excited about the interest in our June one, even after the legislation session is done. Want to really kind of take a second to appreciate that people are really using our Infonet site to engage and interact with their legislators. We saw a significant increase this year, people reaching out both to the governor, to their legislators, to follow up on bills that we had conversations on in regards to the Infonet, or even using it just to make their own access. And that's what it's there for, is to find out who your legislator is and make that contact. So we did see an increase this year, and we're really excited about that. We know people are engaged, they're using the resources and the tools, and that it's working for them. So just a quick introduction. My name is Bill Collistad. I am the Public Policy Manager for the Iowa Developmental Disability Council, and excited to be here for that. We also have Gail, who is our ASL interpreter, who is assisting us and making sure that everybody can participate. And then Amy Campbell is here with us to kind of share with us what's going on and how the session wrapped up. But before we get started, I just would like to point out that if you're wanting to see the speaker, you can go up to the right hand, click there, and go to the gallery, and it should highlight the key people presenting. We are going to put a poll up here in a second that just to kind of determine who's on the phone call and who we're speaking to. But stay tuned at the end. After we get to the wrap up, after Amy presents all the great information in our Infonet, we are going to have a chance to ask questions and to kind of take a deeper dive in some of the conversation we've had, or if there are other questions out there. But at the end of that, we are going to have a survey that we're going to send out to you guys. We'd ask you to fill it out at the end of the day to make sure that we're hitting on the key points of what you want to hear about. So that's a brief introduction. Amy, I'll turn it over to you.
Thanks, Bill. Oh, we probably should let people fill out their poll. Oh, I think I accidentally ended it. Sorry. I forgot that I'm the co-host. Hopefully that didn't. Bill, you might want to say why we're asking that question, just so people know how it's used.
Well, we use it in a few different ways. One is we want to make sure the content connects with the right people. The second thing is that we do share this information with stakeholders, whether it's on the federal level or the state level, to make sure they know who's engaged and who's engaged with our processes for advocacy and for capacity building with the DD Council. And then it's also, I think it's just important to kind of connect with your audience, and making sure that if we have some people, especially self-advocates and family advocates, that maybe it's not resonating for, making sure that we continue to broaden our material so that more people feel like it's connected to them, and that it's user-friendly for them as well. So.
Yeah, and it's non-identifying information, right?
Correct.
So
Correct.
I know that you report on your use of federal funds, and they like to know that you're connecting with families and self-advocates, and that helps with your reporting, right?
Absolutely. Yep. I think at the end for the DD Council, what our ends is to help create avenues for self-advocates to be engaged in the legislative process, whether that's being engaged at bills that are being created, or even in the front part where bills are being written. And so, if we're not doing that, then we're not doing our job. So this is, they want to see who we're speaking to, and then how that's making a connection with them, and then how do those outcomes start to drive way laws are created and things like that. So definitely not self-identifying on the individual level. It's more in a statistical, how many people are engaged. So.
All right. Well, we've got 10 out of 14. So should we end the poll?
Yeah.
There you go. All right, I'm gonna get it off my screen. I can't see my notes because I don't know what to push. Emily, can you get that off this? Do I have to hit stop sharing? I don't know what to do.
Yeah, is it still up for you?
Yes.
Oh,
Hit close.
It's like right in the center of my page, so I can't actually see my PowerPoint. I can't move it either.
Can you use the X up in the top right
There is
if you
no,
hover over it?
there's no X on my top right. Oh, it's because my speakers are at the top. Sorry, everybody. There we go. Thank you. I had to move where my speakers were. All right, now, hopefully that's all of our snafus for today. But thanks guys for joining us. I think we had 30 some people signed up, so we might have a few others that come in. If you just a couple notes, I'll try to go through this pretty quickly, but we can go back to anything if you want to have more time spent on it. But we'll have kind of two segments. The first is the report on what actually ended up happening, and then the session, and then kind of looking forward. So I'll pause at the end of after what happened to answer any questions that you might have. You can either do that by raising your hand or putting something in the chat. We'll try to monitor that as well. When Bill's speaking, I'll monitor it. And when I'm speaking, I'm sure Bill or somebody will be monitoring that too. So just a quick, I know a lot of you got our last issue of InfoNet. Some of you that get it by mail might still be waiting for it to hit your post office or your post box. But the session did end on May 19th. That's quite a bit longer than the 110 days that they were scheduled to run. But most of those overtime hours were just spent in backroom negotiations. There wasn't a lot of things happening. Legislators didn't come to the Capitol every day during that period. They were really waiting to just get an agreement on the final tax bill, which we'll go over because it included some changes to regional mental health and disability services. The governor right now has 30 days to sign, veto, or line item veto a bill. Just so you know, the governor can sign a bill into law. She can veto it, which stops it from becoming law. And on budget bills, she can actually selectively take out sections of that bill, and that's called a line item veto. So she has till June 18th to do that. There's still several bills that she's not yet signed. And I noticed this morning that some of the bills are just getting sent to her. So she hasn't even had them in hand to be able to take action on them. We do know that there's going to be a special session probably in August. Every 10 years, all states redistrict, which means we redraw our political maps. So our congressional districts will look a little different. We'll still have 4 congressional US House members. We didn't lose any because we lost population. And then we'll also redraw the Iowa House and the Iowa Senate. That has to be done constitutionally by September 1st, which is challenging because the census data is not coming into the state until mid-August. So that's why we think there'll be a special session in September to do that. And that's important to you because this could change who your legislators are. So some of you I know have good relationships with your legislators right now, and I'm sure those will continue, but you may end up having new legislators that you'll have to start to develop relationships with, depending on how those maps are redrawn. We know there was a big shift from rural areas to urban areas. So unfortunately, for those that live in a rural area, your districts are probably going to get bigger, which means your legislators will have to cover more of the Iowa map than they are right now. In urban areas, they might get much smaller, and you may see more legislators in those urban areas. So we'll be reporting on that later this summer when that happens. But just know that in a special session, any issue can come up, not just the issue they're coming back in for. Hopefully they won't do that, but you never know. If there's something else that was on their to-do list, they could add that to the agenda. 2021, I just put up some of the issues that were more controversial, more time spent on them. I mentioned the tax cut bill, a lot of tax cuts from property taxes, inheritance tax, income tax. They had some tax credits to help older Iowans that own their homes, and people with disabilities that own their homes, to protect them against the increasing values of houses and therefore the increasing property taxes. Childcare, broadband was a big deal. That's high-speed internet, getting that out to all areas of the state. That's another big piece of the president's infrastructure package too, is broadband. So there's a lot of focus on that this year. Mental health, specifically, I keep reminding people that there's also the other part, disability services, in that, but they always shorten it to mental health. Funding and telehealth, we'll talk about that. Childcare, there was more gun legislation to allow permitless carrying. Abortion was an issue, masks, vaccines, education reform. They even looked at redoing the bottle bill, that nickel you pay every time that you buy a can of Coke, and some other issues. The Farm Bureau wanted ethanol to be have a higher percentage in fuel, but that didn't pass. So those were some of the highlight issues of this session that leadership was really interested in working on. And of course, the budget is always something that legislators have to do. It's the one thing they have to do every year, is a budget. This year it was a fun year for budgets because there's actually money to be spent. $8.1 billion. So this is the first time our state has gone over $8 billion in spending. It's about $300 million increase. And I always like to show this chart because it really indicates to you just how much of our state's budget involves health and human services and education. So that school aid to schools, the education sliver, the HHS make up almost about 75% of the budget. So I just like to show that for perspective, that when you talk about, trying to get cuts in the years that we've had cuts, there's only two areas you can go to ever get enough cuts, and that's in education and health and human services. Luckily, this year we weren't talking about cuts. We were talking about increases, which might be, Bill, the first time I've reported with excitement about the budget. So some of the things that were in the budget, we had some Medicaid provider rate increases. This is mainly because of legislators' desire to help out those that were most hit by the pandemic. Unfortunately, hospitals did not get an increase, and they were definitely hit by the pandemic. But $11 million will go to reimbursement increases for home and community-based services providers. That's what HCBS stands for. And I think the last I heard, when you add in the federal match, which is about 70%, a little over 70% now, I can't remember what the exact amount was, that's about a 5% increase. 7.1 million for habilitation providers, 3.9 million for psychiatric medical institutions for children, and that's a 28% increase. Those are those high intensity live-in residential programs for kids. And then $2 million for home health care services. There were some smaller increases like for ambulance and pharmacists, but those are the big ones. Overall, it was about 44.2 million for Medicaid increases, but of course, that increase doesn't really reflect how much extra money was put into the system, because we have such a high level of federal funds coming into the system right now, because the federal government is matching at a higher rate. So they're giving us more money for every dollar we spend. On children's mental health, there were a couple other things I wanted to note. $1 million to reduce the children's mental health waiver waiting list. And so I have the number at the time I wrote InfoNet, there was 1,129 kids waiting for services. There's probably going to be a new number out, but overall, our waiver waiting lists are almost 16,000 people waiting. So this is a small increase to be able to try to get those waiver waiting lists down. $1 million for AEAs increase for children's mental health services. So those would be school-based services. So that's the 3 million total, and 1.6 million for therapeutic classrooms. Some of you will remember last year we passed a therapeutic classroom bill that allowed as an alternative to classroom clears, some of the behavioral, when they have kids with behavioral issues, they can move them temporarily to a therapeutic classroom that's smaller, more one-on-one time with the teacher. And I think those are still pilots right now around the state.
Amy, just really quick on the budget. Thank you for that. That's great information. I wonder about the 11 million HCBS waiver. I know that there was conversation, and I don't think it was specific to where all that money would be spent, but I know that rates were one of the things that's important for providers, but also, considering the crisis with the providers, the number of staff that are in the field. Do you know how they're going to direct that money yet, or do we have the specifics on that?
I believe it's applied equally across the all waivers. This is in addition to, there's a temporary 10% increase that states can apply for at the federal level.
Yep.
And so this is in addition to that, and it's permanent. So there is some additional money that I think providers can get to, maybe give staff, wouldn't be raises, but maybe bonuses or something, or hazard pay for what they've gone through, or some other kind of benefit for them. But that's a good point. Yeah, at this point, it's across all waivers. There was no directive on how to use that. So I wanted to talk about the tax bill. And it's funny because I call it the tax bill because out of the 28 divisions, almost all of them are, all but maybe 5 are tax related. But when it came up on the screen, when you're voting in the Capitol, they put the name of the bill up on the voting screen, and they called it the mental health bill. So I thought that was kind of interesting. But I say that because I want to emphasize that Republican or Democrat, the mental health was a top priority. Every caucus cited mental health as a priority. And so that, I think you see that commitment in the fact that this is the thing that caused session to be delayed, was that the Senate absolutely wanted to have the state start paying 100% of the regional mental health and disability services system, 100%. They don't want it on property taxes anymore. They feel it's inequitable. It's not fair. It's not fair for a region in some areas to have lots of money and in another not have enough because of property values or because of population growth or loss. So they wanted to maintain the local control and the local decision making and management, but they wanted it to be state dollars paying for it. And so that is what the Senate wanted. The House wanted telehealth payment parity. So they wanted insurance to have to pay equally for a mental health service delivered either in person or telehealth. You couldn't pay, I think 70% is, or 80%, somewhere in that range is what they were paying now for telehealth before the pandemic. So they wanted to make that 100%, that the delivery method would be irrelevant. They would pay equally. So then you got this big bill that had components of what the House wanted and then parts of what the Senate wanted. So this is a pretty big bill. It's basically cuts $400 million in taxes. It also does it in a way that does take some money away from local governments, which could impact services locally, depending on where you're at and how much that makes up for. But it's $150 million taken away from local governments, which could impact your recreational programs, transportation, public transit, and other areas. It's just gonna, we don't know how that impact's gonna be yet. But the big change I wanted to noted was the change in the funding for the MHDS system, the regional system, and that begins this July. So regions have a lot of work to do before July 1 to get ready. The state buys out the system over 2 years, so it not quite splits it, but almost splits it this first year. And then the second year, it's 100% state funded. And then there's an increase built into that. There's also an incentive fund, which is a little bit unknown right now. The legislature went back and forth between talking about a risk pool where a region could apply if they didn't have enough money to get through the year with their per capita, their per person distribution. And then they changed it to incentive fund, which they wanted to eventually create to make it more like an incentive for accomplishing your goals. So if your goal was to have more people living in the community, more people employed in the community, you would be given incentives for achieving those goals. And the way some counties and regions already do this is by directly passing those incentives on to their providers. I know that that's something they're looking at. I think we'll have to watch the rules on the incentive fund to see how that actually shakes out. It may be more like a risk pool in the beginning and change into an incentive fund. DHS and the regions are working together. They meet regularly to talk about what they need to get done. DHS is asking questions about what are your concerns? How can we address them? So I think it's a good relationship moving forward right now. There's a lot of people concerned about, will the funding be enough? And I think legislators aren't sure either. So they're wanting to see what happens. But the big issue is there are no changes in the services and no changes in the expectations that regions have new services available. So I know that there's several coming on board this next fiscal year, the children's services, the intensive rehabilitation homes. So all of those expectations are still there for regions. Another thing to note is that regions will enter performance-based contracts with DHS, meaning DHS will outline what they expect that region to do with their money, similar to what they've been doing already. However, I do think they are planning on looking at more of a performance measured contract. So you can measure quality and not just whether you have it. There is also a note that it may take some time for regions to get services accredited, meaning DHS has gone through their checklist and said that they meet all of the requirements. They only have 2 people doing that at DHS. So DHS has indicated that if it looks like a region is working toward getting that accreditation and getting that service up and going, they will check that off as having that available. So you're not punished for not having it. So that's kind of the basics of it. We did get more, have more detail on in InfoNet and on our website, and we'll continue to post more information about that as it evolves and becomes available. But it should not impact services in the regions. The other big thing I wanted to talk about was the election law changes that happened this year. And those happened early on, you'll remember, but at the very end of session on the last day, there was another bill that passed that made a few adjustments. So I'm just going over what the changes were altogether here. So there were several things. I think the biggest one that people need to know is that your ballots, if you are mailing in a ballot, voting from home, they have to be received by the end of election day before the polls close, which is now an hour earlier. It's 8 p.m. instead of 9 p.m. So polls will be open 7 a.m. to 8 p.m. rather than 9 p.m. Before, you might recall, we had a lot of discussion about postmarks and barcodes. Several years ago, we made some changes so that a barcode could be used to verify a ballot was mailed before election day. That doesn't matter anymore. You have to have those ballots in by the end of election day. So you're trusting the post office to get those done quickly and mailed in, or get them to your auditor's office quickly, which is another issue because you now have a shorter early voting period. So only 20 days versus 29 days. And that was shortened from 45 days 3 or 4 years ago. So we have really gone down to only 20 days of voting before the election. Also to note, you can't request an absentee or mail-in ballot until 70 days before the election. And you must be pre-registered if you don't want to avoid the same day registration requirements. You have to be pre-registered to vote earlier, so 15 days before the election, not 10 days as it is right now.
Amy, just to kind of reiterate one of your points there, make a connection, is that the mail-in ballots, they must be received by the close of the polls. And then if you go to that second bullet where it says there's a shorter period for mail-in voting requests, so I think it's there is you want to make sure you allow enough time to get the ballot, get it home, and then send it back in. 70 days is still, there's still a lot of days in there to be able to complete that task. But often when I request the ballot, I get it, and I'm still, I don't always submit it right away. I sit there for whatever reason. And so that's one of those ones you want to do. If you are going to choose to mail in ballot, you want to recognize that both of those things changed, and also how you can request it. So it's got to be received prior to that. And a lot of people get them in much earlier than that, but before, and you don't want to talk about old laws because that kind of makes it confusing, but before, you could mail it in even the week before, the day before, as long as it was postmarked before. So the big change is, it's not about the postmark, that doesn't count. It's really that they receive it beforehand. So you could take those 70 days and reduce that by 10, maybe 15 days for mailing. And again, that's just, I guess, in case it gets lost or, gets rerouted.
Yeah, I think that the takeaway from this is, if you even think you might be sick or have transportation issues on election day, you might want to make that decision to vote early as possible. So, so that you get that ballot on day 20 before, and have some time to be able to do that. Because the next thing I want to talk about is going to even further complicate that. The legislation allows only a family member, immediate family member, somebody who lives in the same household, or a caregiver to return the ballot. That is a big deal. You cannot have a neighbor do it. that is a felony if they do it. That includes just walking it to the post office box. Now, how anybody's going to know, I don't know, but you can't legally even give it to your neighbor who's on their way to the post office and say, hey, can you drop this in the mail for me? That would be a felony if they accepted that. They did at the end change that to allow a voter with a disability or someone who is blind, and that is the term they use, blind, may designate someone to handle the ballot. There's a form that they have to fill out. The person has to be a registered voter. They can only handle, I think, 2 ballots per election. And they cannot take it to a post office. They cannot put it in a drop box. They must bring your ballot into the county auditor's office in person, show their ID, show their the form that you filled out that designates them as your ballot holder. That's all a lot. I'm just going to say that's a lot to expect. And I think it's not some of the comments that were made, and I know Bill brought this up during the process when he testified, that's not really the Iowa way. Iowans depend on each other to help do things. You know, I rely on my neighbors to help, you know, do stuff. They've occasionally held my mail for me, or, you know, taken things to the post office for me too. I think that's, I think this is an issue that may be revisited again, because it is so complicated. And people might inadvertently, not knowing the law, go ahead and do something and potentially be held accountable with a felony, which, by the way, removes your right to vote. So they also did some things where they took a lot of control away from county auditors. They can't mail out blanket, you know, just mail out the form to request a ballot. You have to actually request them to mail it to you, which is something Bill got added. They were going to make you actually have to go down to the auditor's office to fill out a form before. Now at least they can mail it to you, and when you request it. You can only have, I think it's 1 drop box per county. They did make some exceptions for urban counties. They changed satellite voting. So that's those early voting sites you might see in a library. You have to actually get a petition to open those. Right now, that was law before, but a lot of county auditors assumed that once you had a petition, it could be an ongoing site. This would require you every election to get another petition. And then it allows county auditors to refuse a site if they don't have enough staff, if they don't have enough money, if the landowner wants to be paid for it, they can just refuse to have one of those early voting sites. So altogether, those are some massive changes.
Yeah, there are a lot of changes. And I think one thing that I just want to give you a highlight or a promise forward is that we are going to do a lot of advertisement after we really understand that. I think it's the 5th bullet there, removing voters from active files if you didn't vote in the last election. And so we're going to make sure that everybody understands how to check if they're an active voter. And you can do that right now on the Secretary of State's website. It's really easy to do, to check if you're active. But we want to make sure we really clearly understand the process to reactivate. And we think it's just to vote, but we want to make sure that we have that clear. So you're going to see a lot of stuff from us before each of the upcoming elections, but certainly this summer to make sure people can kind of verify that they haven't been removed by accident or something like that. We want to have people who are active in their voters. So just a promise of some excitement coming forward.
Yep, we had a meeting before this, and we just talked about that. And Bill's going to be connecting with the Secretary of State's office to get just some information about how to double check that you're active and what to do if you're not. So we will be getting that out. A couple other bills that I know people were watching. We had a call to action about the housing voucher discrimination bill, Senate File 252. Unfortunately, that was signed So local governments will no longer be able to pass local laws that say a landlord can discriminate against somebody who uses a housing choice voucher. So they can no longer have those local ordinances. The 3 places that do have them now have another year to before they can't be enforced. Another thing I know people were concerned about is Senate File 389, which required DHS to hire someone to do additional income verification, asset verification for public assistance programs, including Medicaid, food assistance, family support, any type of public assistance in that way. You would have to go through additional asset tests, and they were going to compare with other state data. Really complicated bill because a lot of groups were concerned people would be kicked off and you'd only have 10 days to respond to tell them why you shouldn't be kicked off. I don't know about many of you, but sometimes I go 10 days before I look at all my mail. So that's a little concerning, but that did not pass. I think the Senate wants it really bad, so I would guess that it's going to come up again next year. The ability for people to take their supplemental needs trusts and their special needs trusts and turn them into an ABLE account, so basically transfer it from one account to another, was signed into law, House File 835. So people that have those other types of trusts can now transfer those dollars into an ABLE account, which is more flexible. And also the money in there is protected from most of Medicaid estate recovery. So when the person dies, the state only has a limited ability to go back and recoup some of the dollars that were spent on that person. The direct care worker database, I know a lot of people worked on that, House File 692, that would give a public portal for people looking for direct care workers and looking for the specific types of certification that they have. Did not pass. However, I've heard there's really good conversations going on right now with DHS and the Caregivers Association on that. I don't know if Bill's on, but I know he always brings up, not Bill K, but the other Bill S. But I know that he had asked questions about the guardianship and conservatorship changes. Those did not pass. There were a dozen bills on that to change what had passed a couple years ago, but all of those didn't pass. And I think that people were concerned about those changes, that they would kind of go the opposite direction of what they had been trying to do. So I'm going to pause there before I go on to sort of the next piece and talk about, answer any questions people have about that. I'm kind of looking through the chats while I'm quiet, but I'll allow people to. Oh, Tucker's got his hand up. Let's see. Oh.
Are we good?
Yep.
There you are.
Okay, hi. I had a question on not this slide, but I know maybe it was a couple of slides ago. The difference between when we were talking about that, the increase in spending for a variety of things. I wanted to know what the difference was between the HCBS waiver dollars and the ones that were going to home health care.
Bill used to work with a provider agency. I wonder if you can answer that, Bill.
I don't want to guess, Tucker. I think that's a great question. I do know that one of the things that I've been trying to get a little more information on, and I don't think that they've determined, is how the HCBS waiver, it is going to go across all of the waivers, but there's also that FMAP increase that they're trying to determine how that's going to be. I know that Tucker, your with Medicaid had a presentation. I think there was still a lot of determination, I think, from the waiver office on how that money was going to be divided or prioritized. And then home health care, I think, again, this is just a little bit of personal experience. I worked in an agency for a long time that had a home health care. There are a lot of people that, have nursing needs or specific, that are all that's more Medicaid dollars, but it's not tied to their waiver. So it doesn't take away from respite or supported community living or even their 24-hour care. Home care is directed towards their more medical based. And so I think that they would see, from what I remember, children would have their home health care bucket that would pay for some ongoing nursing, but then they would also have their respite bucket or supported community living bucket, or if they were in a 24-hour setting. And so I think that that Medicaid rate increases for both of those and allows for some increased rates for nursing care, physical therapy, occupational therapy, those services that you could receive under even homemakers is a service you can receive under home care, and then HCBS would see that increase. But did I answer that, or is your question even deeper than that one?
No, I think that's right. Because I mean, from personal experience, I've been injured for 26 years with spinal cord injury. And so I've used agencies as well as right now I'm on a waiver. I'm on the HD waiver. So and literally I just use that waiver for CDAC.
Okay.
And then, the agency covers, the 28 hours allotted by Medicaid for the week, each week. And I do have skilled and unskilled, like I've got, CNAs and nursing visits, like literally every day. So I was just wondering how that differed, because I know that for agencies, don't they use the
Yeah, the way I understood that, Tucker, from your personal experience would be that CDAC, that would increase rates for the CDAC provider, so that you'd be able to increase the rate for the people that would be providing that service. And then when you were talking about the specialized care or the more, the nursing care, that would increase the rate for those services. And so I think the question that I'm under the HCBS waiver is now, how will that be broken out? Would there be incentive to increase pay rates for those staff in that area, or is it going to be a rate increase without it being specific on how that money will be spent? So, okay,
so I guess we'll wait and see on that then.
Yeah, that's a great question.
Yeah, and I think just to follow up on that, I think home health care isn't tied to disability either. It could be somebody coming out of a
sure, yeah,
hospital or something. So it's a broader piece. I don't think that's very much money in the whole overall rates, but I think their concept was they wanted to give money to agencies that employ direct support professionals or direct caregivers. I didn't add in nursing homes got 19 million. They were upset because they didn't get their full 30, but 19 million is a big piece as well. Kelly had asked if there was any litigation filed challenging the new voting laws. I know there's conversations that are happening. I also work with the League of Women Voters, so I know that those conversations are happening right now. I haven't seen anything. Have you, Brooke or Bill?
Not.
Yeah, so I don't think there is any, but stay tuned. I would guess that there will be something filed. I didn't mention this piece in the election law changes, but they also added something that allows an outside organization to challenge Iowa's voting laws. You don't have to have standing, meaning you don't have to actually personally be impacted by it in order to challenge the law. So that could go either way on the election law changes. I mean, you could have outside groups challenging it because of they perceive fraud, or you could have people challenging it based on the new changes. So I think that'll be an interesting piece too. You could tie up everything, all of our elections in the court system if people got really active.
I'm sorry, Amy, I couldn't get off mute. quick enough, but I believe that the Latino Civil Rights Group did file action on this back in March. At least there was an article in the Des Moines Register about it, about the voting laws.
Yeah. Is that a LULAC? Is that the name of it?
Yep.
Yeah. Mhm.
I'm Googling it right now. Are there other questions before I move on? Oh, there's more comments in the chat. Oh, there you go. Kelly found it. So I think there are going to be some challenges. We'll have to watch how that
Yep.
goes, but certainly some of these things are within the rights of a state legislature to do, whether they're right or not. But I think a lot of people are really concerned about the purging of the inactive voters. Some of you may have read that 17-year-olds accidentally got purged because, of course, they registered to vote because they're going to turn 18, and then since they hadn't voted before, they got purged. So that was definitely not what they wanted to do.
And just a plug for that too, we are revamping our voter training here, and we're getting there on that, and then we're just trying to make sure it lines up with the law and that it's being interpreted the way. But also, really, the one that we were talking about this morning is really focusing on if someone becomes inactive. But all of those steps, whether you're mail-in voting, so I will go on the road before any of these elections are going to be coming up to make sure people really are clear of what the new laws are and they're not further discouraged to participate in the process. All the laws did change. I mean, there's a lot of different specifics there, but I do still think that our goal would be to make sure people are really clear what the process is and then how to participate with the new, maybe reduced dates, for example, and then what's the most effective way to do that. So we would be happy to provide that training for anybody, anywhere, anytime. So just a plug for that.
Just a look at federal side, things are really picking up in DC. So we're going to be talking about some of those things in our July chat as well as any, we'll catch you up on any surprises if the governor vetoes anything or line item vetoes something, which I don't anticipate given the amount of negotiations that during the end of session. But just so you know, kind of a plug, we'll be looking at some of those federal side issues, including a really promising bipartisan act that has not, I don't think, been formally introduced yet, the Home and Community-Based Services Access Act, which would basically make it a mandated service. So there would be no more waiting lists. You'd have to, people would have to be given that choice. There's also a lot of other things in that bill, so I don't want to get into them today, but it's kind of a little bit of a teaser that we're going to talk about some of that in the next Capitol chat. However, we do have some information on the infonetiowa.org website. We had included some information when they were asking for feedback from providers and stakeholders and people that use the services, how to improve it. So I think they're in the process of doing those improvements right now. So we should hopefully, I would hope by July we would have a number to be able to reference, but it's looking, I think it's something that a lot of you will be interested in looking at. So Bill, I'm going to turn it over to you to talk about, we kind of had a little bit of a catchphrase today about not taking the summer off. So
Brooke and I participated yesterday in a national call with the NAECD, National Association of Developmental Disabilities, and they really talked about just the next steps over the summer at the national level that the President Biden has put forth his budget for the next year. And there are increases in there for services for people with disabilities, whether it's for our own developmental disability councils or whether it's HCBS services. There's some directed at direct care staff, and then there's the HCBS Act that is occurring. Those budgets, the way I understand the time frame, and I was trying to verify that this morning, is that his budget was proposed, and there's information out there on there, and we'll be sending that out and putting that out on our Infonet and our Twitter and our Facebook account. So if you can see that there, and then we'll try to highlight the specifics in there that could affect services on a national level that would eventually make it to the state. But my understanding is that not everything that's in the president's budget gets approved at the House level or at the Senate level. So right now they're taking those recommendations, and we're trying to make connections with the powers that be on the House side or in the Senate side to make sure that their numbers that they're going to propose in the budget process align with the president's, if we feel like those are a good match. And a lot of those will be considered in the month of July. And the goal, my understanding would be that it's approved by August. And if those dates aren't correct, I think those are pretty close. I know there were a lot of things that we discussed yesterday that different ways that certain budget lines can be delayed a little bit further into the fall. But our catchphrase was, don't take the summer off. We may be asking people to connect with their senators or their representative to say, hey, I know this vote's coming up. This is really important for us for service as it relates to caregivers, or this is really important as it relates to rates, or this funding is important for us from an educational standpoint that affects people with disabilities. And so we'll try to kind of continue to stay on top of how those rates are connected and make sure you guys are aware of what the issues are. And we will have a July cap chat where we'll have more details on that. But we may be asking you guys to continue to stay engaged. So throughout the summer, just to make sure people are aware of what, your priorities are individually, but what our priorities are, I think, for people with disabilities in the state of Iowa. So Amy, there is a question in the chat there. Somebody asked the question about how will the new ban on mask mandates impact students under 12 that receive special education service? So, and you've answered it. Sorry, I didn't catch that.
Sorry, I muted myself. I didn't answer it, but I responded.
Oh, sorry.
I guess my question or my answer or response was we're still trying to get some more clarification on the mask issue. I know schools are still, or were until they ended, still having teachers wear them and still encouraging masks, but they can't require them. So I think it's school by school, how they're doing that. But in terms of the special education setting of it, I think we just need to do some more follow-up. We were going to talk to Disability Rights Iowa and some other organizations that are more in tune with those legal issues. So I guess I'm saying we'll get back to you, but I promise we'll put something up on Infonet when we find that out. I don't know if Brooker, Bill, you have any other thoughts on that?
No, I don't have a thought, but I really appreciate, we're trying to keep, our eyes on the horizon of what the issues are and what the priorities are for the state of Iowa. And so if you ever have anything, we'll have our contact information here at the end, but we'll look into anything for people that, have an interest, and so we kind of sometimes, we try not to miss anything, but sometimes when you phrase a question that way, Nancy, that's great, because it kind of gives us a pulse of what is the information people want to know. And we have been having some conversations about the school and how that's going to affect people, but it does kind of point to what things people are asking for information. So please send me an email or a text, we'd love to have their contact on our Facebook and engage with us there. That would be great. So
I pulled the Bill's blog that I wrote for him because we are encouraging everybody, just to follow up on what he just said, there's a lot of opportunities right now, especially with redistricting, legislators are looking beyond just their immediate border, kind of looking beyond their borders and trying to get to every pancake breakfast, small town parade, town festival, you name it, trying to get their name out there to people they may potentially be in their district. So they're particularly concerned about those new areas of their district and connecting with people there. And connecting with them means a lot of work. They door knock, they make phone calls, there are postcard writing efforts, there's parades, and they always need volunteers for that. So I always encourage people, because that's a really easy way to start developing the relationship with their legislator. Or if you already have one, showing your gratitude for them helping you on something. Obviously, if they didn't help you and ignored you, you might want to look at who's running against them when the time comes. But I think that's a great way to make those connections with people, is to just start by volunteering. And they have jobs for every type. Like, I hate phone calling. I will never do phone calling. I just hate it. But I love door knocking because to me, it's like exercise for a purpose, but I will do that. I take my kids in the parades with people that I like, and they have fun throwing candy to people, So, I mean, those are great opportunities to just make those connections. And I think you just have extra opportunities now because legislators are all nervous about all these new voters that may be in their district. Also, ID Action and DD Council can help. They have opportunities if you want to do like a town hall with your legislators and talk about issues. I often encourage people, just go have coffee with your legislator, or if you're concerned, go meet them at a park. And you have the open air and ability to talk about your issues outside and maybe stay socially distant, and be able to have those conversations there. But also, we had a family group that did some recorded pitches on their issues, and those are really great. They did a fantastic job, and we're going to try to feature some of those on InfoNet. But if you record your story or message, you can also share them with your legislators. So it's not just writing an email, but it's actually you telling your story and you're talking about your issue and sending it to them or posting it on social media. But we'd also be happy to get that word out to others as well. That kind of helps out with, other people that are nervous about doing it, seeing other people do it makes them more confident in being able to do that. So if that's something you're interested in, just smartphone technology lets you just do your own recording pretty easily. But I know legislators responded pretty positively to some of the recorded advocacy stories they got this session. And I kind of put this little plug in that I know we've had a ton of people on here that have done a lot of this already, and just give an opportunity if anyone wants to add anything to that, or other forms of advice. I don't see any hands raised. Everybody's hungry. It's almost lunchtime.
This is Kelly Rice. I work at Voc Rehab and have served on the DD Council until this month, and been succeeded by a coworker. I just wanted to emphasize what has already been said, that this is the best time of year to pigeonhole your representative or senator and put a bug in their ear about what's important to you. It tends to take several years to pass, or at least a couple sessions to pass bills. And the earlier, as I say, you put a bug in the ear of your legislator, the more likely you are for her or him to talk to others and maybe even get a few people in support of your position before the session starts next January. So if your summer is boring or free or whatever, just reach out to your legislator. Every time I've done it, it has been such a welcoming experience. So I think they like it when we contact them, and this is the greatest time to do it. Thanks, Amy.
No, that's great, Kelly. Thank you very much. Yeah, we were talking before this meeting, and I said, oh my gosh, I would rather have people contact their legislators in the summer and fall than during session, because they're just so distracted during session. You have such better conversations outside of that and back home in their districts. So.
And just another plug, Amy, just to kind of connect to that, and thank you, Kelly, because we had Amy and I had a conversation with Representative Meyer, who's out of Fort Dodge, and she was talking about a connection she made with a family member, and it was exactly what you talked about. It was in the summer, and really her take on the whole legislation that went forward, and it was the ones around changing tables being in rest stops. She said she was unaware, and she said the conversation was really simple. The mother just showed a picture of her daughter being changed, having personal cares done on a bathroom floor. And she goes, I could not get that image out of my mind, and just really talked about how that moved her forward to putting forward some strong legislation about that. Part of that story is it didn't get passed, but then money did get put in the Department of Transportation budget. So I still see that as a really strong win. But to Kelly's point is, this is the summer and this is when it happens. And I've really been encouraging people, the more I learn about it, is not to be intimidated, just have a really personal conversation. This is what's happening, and this is what I would like to see change. And that's what our representatives are there to do, is to figure out how to make that change happen for us. So that's great.
Oh, Tucker's got a
Go ahead,
question.
Tucker.
Oh, sorry.
Can you hear me? You got me?
There you go.
Okay, cool. All right. Well, we're already into like the third week of with Upgrade Medicaid, which is if you folks aren't familiar, it's just basically a grassroots advocacy group of all mostly disabled and allies.
Oop, you cut out. Can you guys hear him?
No, Tucker, I think you cut out you were talking about Up with Medicaid and a group of allies and working together in the third week, if you're there.
Yeah, okay. So we're in our third week of a storytelling workshop. I think I don't know if their videos are going to be released later, but really my point is that personal stories are extremely effective with legislators and just with people. So if you can personalize your story or someone else's story, or help them in some way to focus on creating a picture, much like you were describing, but in words, and really work at making your story short but to the point, but very striking, it makes a huge difference. So I would encourage people to work on that and encourage others to do the same, because it works. It's extremely.
Thanks, Tucker. We did that. That's awesome. I'm so glad you guys are doing that too. We did kind of send out those workshops. I think they're on our social media pages. But hopefully you can see, I put up their website. If you just look at upgrademedicaid.com, and there's a spot where you can share your story. I didn't know you had a podcast, so I'll start listening to that too.
Yeah, if you follow the Facebook page, we're kind of in the midst of not restructuring, but regrouping in a way, kind of just to find like what our direction is going to be. Yeah, we typically share the events, and the Iowa Disability League, which is something that's upcoming, a nonprofit organization, grassroots, but looking at wider issues across the state, beyond Medicaid, for persons with disabilities. So yeah, that is what the storytelling thing has been through. So keep an eye out for that too. you know, I wanted to just say that I appreciate you guys like really focusing on talking about all of these issues because it's extremely important.
No,
Thank you,
thanks,
Tucker.
Tucker. And don't feel shy about letting us know when there's other stuff going on. We'll happy to get the word out too.
Oh, thank you.
You guys are doing great work. I think we're 8 minutes past now, so probably should. Well, we did mess around at the beginning because I couldn't figure out how to turn off that screen. So,
And Emily, you'll be sending out a survey to people. Please take time to fill it out and give us feedback. Want to make sure we're hitting the target for you guys on these meetings. We've had great participation. Our summer one, we still had 20 people here. We had over 35 on all of the ones throughout the session. So really excited by that engagement and connecting with organizations like yours, Tucker, because that's how we get things moving together. So
That chat is in that link to the survey, Bill, is in the chat right now. So people can click on that right now to take it.
perfect.
Because we want to hear from you guys on how to make these better as we go forward in the next year.
all right. Well, I think we're a
Please,
wrap.
folks.
Thank you guys all for hanging in there and attending today. I know it's nice and warm there. I'm in Texas right now, but it's cold here, or not cold, it's cloudy, but enjoy the weekend.
Thank you, Amy. Thank you, everyone.
Bye-bye.